Hello everyone, welcome to a new episode of Women Wisdom Hub with me, Amira.
And me, Caroline.
Hello. In today's episode, we have our psychological therapist, Dr. Anthony, who is happy to join us, and we will be having a conversation about cultural impact and on mental health. But also we would delve in a little bit into some of the challenges and the biases we have to overcome as therapists. And so, hello, Anthony.
Hi.
Would you like to introduce yourself to our viewers, Anthony?
Oh, okay. That's some privilege. My name is Anthony, and I'm currently practicing as a psychological therapist, but I've had my background across medicine, psychosocial studies, and now psychological therapy. So sometimes it's a bit confusing on what to address myself as. So as I was telling
because you're wearing many hats.
Yeah, it doesn't bother me anymore. I'm just Anthony. And so at the moment I work with individuals experiencing diverse psychological challenges, and also use my experiential knowledge of navigating a career transition to guide individuals who are at the same point I was in navigating career transition and dealing with the stress that comes with it. And I'm quite happy to be on this platform to have a conversation with my colleagues here.
Thank you, Anthony. Thank you. So, Anthony, you are very passionate about looking into the impact of culture on mental health.
Right.
I believe you've also looked at and you've worked yourself with some of the underrepresented communities,
Absolutely.
such as refugees.
Yeah.
You've used your expertise, but also realized there is a lot of, impact of, on their mental health. Not only cultural sort of impact, but also sometimes the impact of discrimination or prejudice they might also face.
Absolutely.
In their pursuit to kind of establish themselves in a new environment. So we just wonder, how do you think you would navigate when you're working with clients, navigate that world?
I think it's just different layers, really. I think I need to trace back to when I first choose to investigate the mental health consequences of racial discrimination amongst refugees. And it was starting from that point when I was doing that dissertation. That's when I got introduced to the complexity of the context that you have to navigate as first a person of color or a person who is from any minority within a profession that is so westernized. If I didn't remember the statistics on top of my head, I think HCPC at that 2020 said that about 92% of psychological practitioners identified as white, 1.7 as black, and maybe 3.6 as others. And the same thing with British Psychological Society, about 90 identified as white, then 1.7 as black, then maybe 6 point something as others. And it tells you how it's quite hard when the statistics is still underrepresenting black people. And that for me was an introduction to what the road would look like. So I always knew it was going to be tough, and tough in different levels, tough in the sense that what I was researching, I was also experiencing it by myself. So it's like you are embodying your research. You're seeing what is happening to refugees, and you're like, wait a minute, I'm experiencing that as well. I'm experiencing somebody being incivil. I'm experiencing someone who just treats me with disrespect because of, my color of my skin. I experience people who don't recognize the work that you're doing. So it was a hard introduction. But what I told myself was, I needed to go ahead and study this particular line of inquiry. I wanted to know. And it was interesting as well, because you would think that racial discrimination shouldn't be thrown at, or prejudice should not be given to people who are very vulnerable, like refugees. You would think that. On the contrary, they were extremely racially discriminated against. And that speaks to you about the difficulty and the kind of environment and the kind of context that we are living in. And so for me, having to do that work and then coming on to, both as a researcher in that field and also as a person of color, answering your question, is different layers and different contexts you have to navigate every day. While you're working, you could be discriminated against as a client, a service user discriminated against you as a therapist of color, colleagues. So it's a very, very multi-layered difficulty you have to navigate every day. And I would say, I think the motivation is always, it keeps me going. You want to know more about it and see if you could help other people. Yeah.
Because you do, come across as very passionate. I'm sure a lot of maybe our viewers already, have seen some of your videos that you post on LinkedIn, and you kind of address some of this. But it's also interesting, Anthony, because before we started airing the podcast, and we were having the side conversations that we always have. Caroline touched on her own research, and how when she was doing her own research, actually, at the time, and when she started herself becoming a therapist, she realized some of the prejudice amongst the profession itself.
Right.
Among therapists, amongst each other, and also therapists towards some clients. And we were talking about how that's very important for us, because in therapy, we always learn as therapists and counselors about reflection and how we can manage our own emotions and our own biases. So, I wonder, Caroline, also if you wanted to refer back to your research.
Yeah. So it was back in 2011. So a few years ago now, but when I was training as a psychotherapist, and like I was saying earlier to both of you, that I had trained with these people for kind of 4 years and thought I knew them really well. And then I did this recent research into how psychotherapy trainees experienced working with clients from different cultural backgrounds. And through doing that kind of in-depth research with them individually, I did find that there was quite a lot of prejudice that was coming up with the trainees in terms of the different cultural groups. There were certain cultural groups that some of the trainees didn't feel comfortable working with and didn't want to work with. And I was so shocked and surprised. And I think one of the things in the research that I mentioned was that I thought more training should be given when you're doing psychotherapy or counselling training or some form of therapy training, in terms of thinking about people's cultural backgrounds and doing some cultural training, because it was missing from my training. I didn't have any training on sort of cultural elements of therapy. I was quite shocked. I was very shocked, and it was difficult for me to then look at those trainees that I'd trained with for 4 years in the same way, because they were coming up with all their different cultural biases. And I was thinking, well, I guess it's important to own it, but yeah, that like you were saying about reflection is so important, Amira, isn't it? To kind of reflect on if we do notice any biases popping up for us, it is important to reflect on that and talk about it in supervision, and to be mindful that if we're working with clients from a different cultural background, to be curious about their culture. And it's very important to, I know that the three of us would naturally be curious about people's cultural background when we're working with them. It just seems like a given to me, but I realised then how much prejudice there was and how much bias there was against culture groups, and it just really upset me and just really shocked me. But I guess that made me realise that actually it was quite good to do some research on it to uncover this, and it's something that should be talked about, I think, and not kind of swept under the carpet. So yeah, it's so important, isn't it? Our cultural background, it's part of our identity. It's where we come from. It's how we relate to others. It shapes our values and beliefs and our worldviews. It's part of therapy, isn't it? And if we're working with someone, we want to understand them, don't we? And that will help with the therapy. Absolutely. Sorry, I could talk about it all day.
That was very interesting. You've mentioned your experience with actually observing this prejudice from trainees you trained with, amongst themselves as a trainees, and also towards some of the clients. I wonder if sometimes as well we observe a bit of like a reverse as well. Some of the clients can have the same sort of prejudice towards some of their therapists or the healthcare professionals they're working with. So Anthony, is that something that you've kind of looked at? I wonder, and when we talk about also as, the context of this prejudice, disregard of which, from which group, is it more about the power dynamic, or is it a combination between power dynamic and just the unfamiliarity? Sometimes when we're unfamiliar with something, as part of being human, our by default response is that, to protect ourselves, we don't want to know. So what did you find, Anthony?
I think Caroline research is so striking, and it just makes my heart to tick, because on one hand, it speaks to that dynamics that happens between therapist and the patient, okay, which is T to P, and it reveals the idea that generally, and you would think that it has improved from 2011, but it hasn't. It hasn't. A very recent article still shows that therapists do struggle to engage in complex conversation around race and culture. I think that was a particular literature that was very significant in my research. And they sort of shied away in terms of discussing, act of prejudice, it therefore means that such therapists would struggle to even, I'm going to unpack in two levels. It therefore means that those kind of therapists would struggle to either want to learn more or to be curious about other race. If you are struggling to have that conversation, if it makes you feel uncomfortable. And so on one hand, back in the days, it wasn't very until recently, I think, in particular literature, I talk about the cultural landscape. Then we now start looking at the culturally adapted CBT, and so we start talking about, okay, let's see how we could understand more of cultural. Then we now have culturally adapted CBT, so let's understand different context of client. And so maybe we could excuse them because at the time we didn't have enough literature at the time. But I'm still wondering, we are in 2025 and I did my research in 2022 or 2023, and it's the same thing. It's the same thing. Therapy, Western therapists still, when it comes to racial discrimination. In fact, what was even more striking was that unaccompanied refugee minors felt judged by mainstream practitioners in 2022. And you wonder, land research was in 2011, and more than 10 years after, we're still experiencing. So it really speaks to, it goes beyond what we claim the unconscious bias. I hate it from a very anecdotal point of view when we reduce racial discrimination and say, oh, it's my unconscious bias. No, it's not. It's no longer unconscious bias anymore, because we are now in an age that is really, there is knowledge everywhere. What's making you unconscious about it? So, and it speaks to what Caroline research, we could compare the time, 10 years after somebody I never knew did a research and she found out that therapists could experience, or they could give or act in a prejudicial way towards their patient, and the same thing is still happening. So apart from seeing that to be unconscious bias or the lack of training, it also reflects the willingness for us to stay curious and reflect and do better, because you're going to hold yourself accountable to address your own discomfort that comes with you whenever you're working with the other. Okay, you have to be the one. So one, it also speaks about not having the diversity of patient and client. Up until now, according to statistics from the NHS, people of color or any minority have poor access to higher services. And so where are these therapists going to see, the other, individuals to work with, when you're still seeing the structural and systemic, barrier that is keeping people of other ethnicity to get access into the system or the learning structure that would make trainee therapists to have the experience to deal with people of other cultural background. So you see how convoluted this is. Okay, on one hand, maybe they might want to learn, but again, the system doesn't allow people of other ethnicity to have access. And it's very frustrating, very frustrating. I've perhaps been in this career now for 2 years, but training and now practicing. I haven't seen a black client yet. I haven't. Where are they?
Gosh, that's really powerful, isn't it?
Yes.
Yeah, I'm just thinking on my caseload, I have got one a black client, but that's it. And it's not very diverse, is it?
No, it's not. The therapist makes sense on one hand. I'm not saying anybody's excusable to racial discrimination. So on one hand, the systemic structure is not doing them good. And though Caroline did our research in 2011, the same things still happen until now. All right. So that is the T to P, okay, when therapists discriminate against the patient. But sometimes patients themselves discriminate against the therapist. And that is most often seen when, patients who are white patients and discriminating against therapists of other ethnic minority, Black, Asian, and other minority ethnic group. And that again speaks to the impact of the underrepresentation of therapists of other ethnicity. Because if the patient is always seeing, what they see on the media, the psychological therapy is always a white person, sitting down on the couch, their understanding is that, they'll spread, association between a psychologist, psychiatrist, therapist is going to be a white person. And so they turn your camera and they see another person like, oh, what's going on here? They will doubt you, they question you, they wonder if you are capable, are you knowledgeable enough, are you psychological enough, and they could, particular black psychologist said, after a client booked her appointment, she turned up, this is in America, she turns up and asked her secretary, who was white, who is a psychologist. And it's like, you just booked me online. Are you blind? And it speaks to the fact that people tend to, try to diminish, question your competence when you don't look like what they know. And that could be because of the underrepresentation. I've just mentioned the statistics by the HCPC for UK and BPS. There's poor representation, 1.7, people identify as Black, 6.1 or so for other ethnicity. So it makes sense why they're not used to seeing other ethnicity as therapists or psychology or psychiatrists or mental health professionals. You could excuse them, but you don't have to. I don't believe you could excuse anyone when they act in a way that is degrading to other people Because if you call HMRC right now for a tax refund, you don't care who's going to pick up that phone. Whether it's from the Mars, the moon, or wherever, you don't care. You have to be polite. You have to act in a way that is kind and all of that. The same thing on the train. They have their card everywhere. We don't tolerate rude behavior. So I think it speaks to the fact that we need to do better when it comes to the P to T now. When it comes to when therapists are being discriminated against by patients, we need to do better. The service has to be accountable to check those things. So going back to your question, to it is power dynamics, a little bit of power dynamics across the two groups, because racial discrimination is underpinned by the idea that because of my skin color, I am better than you. That is the bottom line of racial discrimination. And so the patient could also think that he has a power because of his skin color. So when he sees the other therapy, he says, because of my skin color, originally or inherently, I've been thinking that I know more than you. So he sort of becomes so unconscious, quote unquote. He's become so arrogant in the setting that he forgets that he's in the place of seeking help. And so if you're looking for help, you wouldn't care who is giving you help. That should be the expectation, right? But because of the racial discrimination, the prejudice, he becomes blinded to the fact that he's here to get help. And so he allows the arrogance of the idea of racial discrimination based on skin color. I'm more knowledgeable than you. So you could see that when a patient is discriminating against the therapist. So that is the argument there. When it's about the therapist to the patient, I think it's a combination of both. It's a combination of, because there's an inherent power dynamics that comes in the seat of a therapist. And so we want to know how to manage that. So a therapist who is having prejudicial bias with the power dynamics is dangerous. That's what I would say. Because I've had a chat with a client that's a patient from a different minority that said, I felt judged. I walked away from that session. I felt very, very bad about myself. And that's what you could hear when patients are in that kind of therapeutic circumstances. So it's a very terrible situation when it's a therapist discriminating against a patient.
Yeah, because you want to feel understood, don't you? Not judged.
Yeah, it's very dangerous. Yeah.
That's the reason why people come into therapy, isn't it?
Yeah.
So if we're not getting that experience,
There's still a lot of work to be done then, isn't there, Anthony?
Yeah, sometimes it's very discouraging, Caroline. I've had this conversation and I said, you have no idea there's nothing you could explain to anyone to understand the context you have to navigate when you are wearing this skin color and having to do the work, and you turn up and you're having to deal with, some arrogance at work. A recent survey from the NHS England, by the Royal College of Psychiatry mentioned that mental health trust service user, staff within mental health trust service user were still experiencing about 83% of harassment that was underpinned by race. This was just back in 2021. It's not in 80s. It's just very recent. So the work is enormous. And my worry is that it's becoming a tick box exercise. That is just my worry. That is my worry. That's my concern, that this conversation is becoming a tick box exercise. And if it does get to that point, then it means we are defeated from the start already. So there is a lot of work to do, but at the same time, the work that's being done is already turning into like another metaphor. Let's just do it because we want to do it. And that's concerning, because it's not helping the therapists, it's not helping the trainees, it's not helping. It's also documented that people of ethnic minority had a negative outcome from mental health services. It's well documented.
This is an interesting point, Anthony, because when research looked into it, they kind of focused on access to resources and the barriers of that. One of the things I think they've identified is language barrier, where they actually services have to kind of use lots of interpreting sort of services to kind of support people with attending their appointments. They've looked at cultural impact. Some in certain societies, mental health isn't as advocated for as we would like it to be. And that's why the idea of even going for a therapy, it's not something they speak about based on that culture, or, it's something that they don't see it as a priority. They don't see it as valuable. So they've looked at, it's almost the research, again, it's a Western research, as almost like justifying the issues we've just identified.
Yeah. I think some research, we need to understand that research, at this point in time in my career, I take every research with a pinch of salt. I want to, because there are always going to be agendas. There are always going to be conflict of interest. There are always going to be who is doing the research. Like Relly said, research that is conducted by, I'm not doubting the genuinity of any research, but I'm also being able to develop some skepticism about whatever the outcome is saying. Because take, for instance, unaccompanied refugee minors, and who turns up for its service, and the therapist hasn't for one seen any other client that looks different to him or her. Like you already said, the first response is going to be, okay, you just want to treat as the order. Okay. That is not what everybody does. Okay. But that is the normal on human instinct when it comes to the context of racial discrimination. So if that refugee minor leaves that therapy room, one thing that we know about other ethnic group is that the collectiveness. For the blacks, we have the we language. Okay. We have, they have this sense of, I think the Philippines, they have a collective language. So that person leaves that room, goes to the community and says, oh God, I gave it a try today, but I was deeply judged. It felt terrible. And you remember these groups, they have their mocks, they have their prayer room, they have different things. That message goes around. What cost it? It's not really about their expectation. It's about they've been let down. Okay. And that is what we forget about. And I think one of my, when you look at immigration, there's what we call, like a social connecting tools, how people connect with themselves. And when it comes to other communities like the Asian, they have a very strong bond. Okay. And they have, I think there's a joke that says if one person, Asian, is sick in a hospital, the next 2 days, the whole community comes. Okay. So it speaks about that collectiveness. And so you can see how one treatment, I'm not saying that's always the case, but it's so easy for us to, same thing with the black community. Okay. We are definitely going to speak about, share, people gather information before they go to therapy. They're going to speak to one person or the other. And so imagine if the other 2-3 person that they spoke to had a terrible experience. What's going to happen? They're not going to turn up. They won't turn up. They'll be discouraged. Okay. So that is one thing. Okay. And so it speaks to how can we improve the services so that the people that are there by word of mouth could increase what outcome that you have seen. What will be the impact of that? We've not thought about that. We've not thought about if we improve the access to black community, if we adapted the psychometric tools to reflect the languages of other communities, what would that look like? Would that increase access? If it did increase access, what's going to happen to the outcome? What's going to happen to this thing that we're talking about, language barrier? What happens if you employed interpreters? What happens if you employed a more diverse workforce? What will happen?
To the issue you've identified at the beginning, which is even the underrepresentation of ethnic minority therapists, isn't it? And I wonder if it's an issue with accessing the training from the start, whether is it like culturally it's not appealing to or that's one thing, or is it the selection process is also there is a prejudice applied there in the admission and selection process.
I think BPS recently published data about that, and they said 89% of I can't remember the exact number. It said like 89%, it was in the 80s, of the 90-something application of white people into a PhD program were accepted. Right. And about 1% or so was for the black community, and about 3 or something for the Asian and other minority. And so that is a problem as well. So it's not necessarily about the interest. It's about the problem in selection. And sometimes we look at also the systemic discrimination that goes on in some of these, universities. And, recently it has improved, like in the US, it's coming up now. I think the recent publication said it was up now to 32%. But it also speaks to the bureaucracy of, if I did medicine in Nigeria. I have a background in medicine, and I'm just about writing, if I want to, write my PLAP exams to get a GMC registration. You could, across the NHS, you see a lot of...
Practice as a GP.
Yes. Across the NHS, you're going to see a lot of, foreign doctors, foreign trained doctors. But if you're meant to get as a foreign trained doctor into any of the psychological program, you can't. You have to demonstrate rather than KSA, so many things. But ask yourself, wait, is the same foreign doctor that running your GP clinics and all of those things? Why are you subjecting them to this extra scrutiny for something that very well they'll come top out of it? So for my experience, I had a lot of things I had to write my KSA, and all of those things. But eventually I got into the training, and I was charged as a foreign student. I paid triple, if not more, of what the local student were paying. And so you could see the systemic thing that is in place.
Tuition fees, it's just something else.
So you can see the system.
Shows how keen you were to do that.
Absolutely. Yeah, I think I had a conversation with somebody and said, look, I work hard for this stuff. So it's a lot of systemic thing going on. There's beyond just the selection. There is, all the systemic barriers. But again, I think there are ways we could solve this problem. There are definitely ways we could reduce this text. We could reduce this unnecessary scrutiny. I think BPS is talking about the same thing. They recommended a couple of things to do, and their, allocation and those quota. I'm always waiting to see if this thing would just change from a tick box exercise to what is really being implemented. So I think it's about the training, it's about the access to the training, it's about the selection for the training. And again, when I was doing my training, I think it was just maybe 2 Black students and the other minority, and both of them were here for a while. They were sponsored, but I wasn't. Again, you could see the representation. It was still 95, 1.1 other in the groups. It's quite an interesting thing, and I think we could do better. Really, we could do better. Yeah.
And I think this podcast is really helpful, isn't it? And people watching this hopefully will find this helpful to hear all the things that you're saying and that we're saying about all of this. Yeah, it's such a massive topic, isn't it? And it really deserves attention, a lot of attention. And I'm sure your clients, your patients really kind of benefit from your cultural lens and from all your training and your determination to be doing what you're doing. Just sort of curious about, so with cognitive behavioural therapy and trauma therapy, thinking about trauma therapy from a sort of cultural lens and people having, I suppose, different experiences of trauma. How do you kind of approach cultural lens and trauma, and sort of working with trauma from different cultural perspectives of the patients that you're working with, if that makes sense? Sorry, that was a really long question.
I think that's a very interesting question. I think I'll kind of break it into 2 prongs. Okay, and the first one is, I, as a person of therapist of color, treating anyone, not necessarily my same cultural context, maybe a white client from anywhere, okay, and they're experiencing trauma. I think I usually, as a practice, really want to pay attention to my inherent bias in terms of, African culture is a lot about that, not showing weakness, not coming strong, being tough, and we glorify toughness. And so I think I normalize to a fault. I really would, I tend to always make sure that I am normalized and I'm very much aware of where my context could get in the way of how I'm working with someone else from a different cultural background. Okay. And so that is on one level. So I tend to become aware of my processes, and also really sit with the client, really listen and take away maybe lens of judgment. So it's always a case of checking in and asking, do you think I'm hearing you very well? Do you think I'm hearing you? At every session, I think I want to ask that question. Did you feel that I'm hearing? And again, also as especially in the context of working with a client, a female client, and also now that becomes like a double layer, both as a male and also as as a person of color, especially if it was in the context of maybe abuse or on all those kind of male perpetrator kind of trauma. So it's about the case of really being present at that point in time and checking in and seeing that my cultural lens is not blurring my interpretation and how I'm hearing this particular client. And so that's one prong. And the other one is when I have to now work with someone who has a different cultural context. Okay, maybe they are Asian who have grown up in a patriarchal culture, which is, and that is impacting how they are processing their trauma. Again, it's still that being aware of that landscape that they're coming from. So it's always about, do you know this person's cultural landscape? Do you really know how this person is experiencing this difficulty? So it begs the question, how am I willing to, sit back and ask them how that interpretation played out based on their cultural context, and checking in. And sometimes I remember a particular instance where we got to the point of looking at the perpetrator, and this particular person thought, no, I can't. It's my dad. I can't really point fingers, because that culture was, you can't speak badly about your parents. You could see how that culture really played out there. And so we have to break that barrier, and you have to make them see what this is not, that it is not about blaming. And so I think it's about being aware of the landscape because the context matters a lot. The context plays out all the time. It matters a lot. And sometimes because of that, you also want to see how you take the psychometric tools, because these are all Western tools. It wasn't done in other contexts. So you want to be skeptical, because in a context that really portrays power or portrays not showing weakness, they could minimize their scores. But meanwhile, they are really experiencing difficulty. So it's not using the psychometric tool as the gold standard of what an indicator of what they are going through or the measure of their difficulty, but really stepping back and understanding the landscape and how the landscape is leading to how they are sticking their score, how they are communicating their difficulty at every point in time.
Do you feel that sense of responsibility, Anthony, as a therapist as well, as a therapist particular of a color, maybe contributing to, the process of adapting these psychometric testings you've mentioned? For example, in CBT, we can start to look into adapting certain
Yeah.
measures, and also obviously by default translating them to our own languages, but
Yeah.
also about doing some work, using your expertise, which is
Yeah.
now the notion of adaptive
Yeah.
CBT.
Yeah.
So do you feel that responsibility to also step in and do something about that?
I think I felt that responsibility out of necessity at some point, because I remember a particular client, I think it was from the Asian cultures in Syria also. And we literally started I literally misdiagnosed him for generalized anxiety because of what he was presenting at the time and how he was communicating that. I don't know, by stroke of chance, I told him, okay, why don't you just go away and just do a thought record and come back? And he came back, and all of the he was speaking about was things about loneliness, about, being sad and all of that. And then I now realized that he was misinterpreting depressive symptoms for anxiety symptoms. And that was just because of the language. So I had to ask him, okay, what do you call anxiety? What do you describe as anxiety? Let me see what that sounds like in your own context, in your own culture. And then it was something else completely. And then we now shipped the diagnosis, and then we got it right. So I think I felt that out of necessity to always, at any point in time, I want to check the main key difficulty, the language that is used to describe that difficulty. Because by there's some words that doesn't have English vocabulary for them. And so they have to make do with an explanation. Once they're doing that explanation, so I could understand them, something is being missed out of the way. So it's about asking them, does this comes across directly in your own language? What is the key theme about this difficulty? What is it called in your language? And then we could see how, thankfully we have Google Translator and all of those things. And then we could walk our way and see how that really describes their experience, because we are most likely going to miss out, especially with some culture that doesn't have an English vocabulary for that difficulty. You could miss that out. So I think I felt that out of necessity, but maybe I don't have the time to do it.
So you felt curious to do it, and that's what matters. If you've had the curiosity to do it, you want to understand about it.
Yeah, Caroline, what were we saying?
Yeah, no, I was just thinking that we could talk about this all day, couldn't we? Because it's such an important subject.
Absolutely.
Yeah. So just thinking about, Anthony, where you've mentored a lot of young people, and just wondering how you help them to stay true to their cultural identity while still growing into what they want to be.
Yeah.
Any thoughts on that?
Yeah, I think that is a very interesting observation you've put out there, and because most cultures have their significance, as we all know, and it speaks about that identity. People hold their culture, especially when it comes to the culture overlapping with religious, background as well. It constitutes their sense of identity, and especially for individuals who have left their primary culture and now having to navigate a new cultural background here or context here in the UK. It's always about that conflict, and so we know about things like culture shocks and all of those things, those concepts. But it's always about you seeing working on two different contexts. On one hand, you have your inherent cultural identity from a different culture. Now you're being exposed to a new environment that demands that you do things differently, and so values would now change. And so most of people get lost in trying to manage the values of the new culture and also still maintain the values back at home. And so you could see that conflict, and that definitely impacts on how and the burden of mental difficulty they're experiencing. So I think for me as a therapist is to really get back to that point of helping them to see and identify what culture do you have to maintain. There are different ways we have a culturalization. We have, when we are exposed to a new culture, we could either decide to keep a bit of our previous culture and then ignore the new culture, which is not really that good, because the new culture also has some valuables as well. You don't want to miss out on those valuables. Of course, there are different things in the UK that is quite helpful. There are different concepts in the UK that's very helpful. If you shut down on learning a new value from a new culture, you're not doing yourself quite well. Some people could respond to a new culture by getting lost into the new culture. So they abandon all their old cultural values and they get merged into the new culture of the UK. That is not also that good as well, because you also have some values before you get to the UK. So you don't want to throw away your own values. Okay. And then we can also have the more healthy way, which is like a balance. You keep a bit of what you knew previously. You see the one that were helpful and also pick what was helpful here rather than taking everything. And my role is to guide every young person to make that decision, to help them take stock, to help them see, what am I willing to keep? What is not helping me more? What is not helping me anymore? Okay. What can I identify and mesh them and pick what I can pick? And you're not going to keep everything. You just can't. How can I guide them to make that decision? And that's what I do with young people when I'm working where I come from different culture. You're not going to force them. You're not going to load your opinion on them. You want to help them identify which of their, like in such a very practical way, what do I want to keep? What is not going to be practical here in the UK, and what is not in the UK that will be helping me or be serving me and is conflicting my own cultural values. I'm having the agency to make that decision, to choose from them. So that's how I've been guiding young people, to help them see how we respond to culture and different cultural landscapes.
That's great. Thank you, Anthony. And I'm just thinking, I guess you can draw on your own experiencing, can't you?
Absolutely.
You've got a wealth of experience, a rich experience that you can draw on in order to help those young people.
Absolutely. I think I've been to navigate that myself. Sometimes you could just hear you just want to say, just don't do it. But you can't do it in therapy because you want to, keep them to make that decision. It's not your own business. It's not your decision. It's their decision. So you just have to just sit on your hand and say, just go on. Yes, I think I've had, a lot of anecdotal experiences, and you had to learn that for yourself. But it's about guiding them to make that decision by themselves, really.
Yeah. I don't know why I was just thinking about food when you were talking. I was thinking you might have your own experiences of lovely food that is part of your cultural identity and something you really enjoy, and you'd want to bring that with you, wouldn't you? Would you?
Of course.
100%.
Of course, I can't abandon Nigerian jollof rice.
Yeah.
There is no fish and chips anywhere that can surpass that.
It's a really interesting, sort of topic, a broad one as well, a very broad one, like you sort of pointed out for a line earlier. We could be talking about it, until, sort of, the next day.
Absolutely.
If, Anthony, think about those people who are actually, listening to us today. Some of them might be clients, some of them might be fellow therapists, some of them might be policymakers.
Yeah.
Government representatives. If you want to give them one or two words, just using one of two words, think about one or two words you want to get out to them today that will help them in any interactions they have with any person of a different community or a different color, that will help the person to feel, the person they're interacting with, it will help them to feel seen and listened to and understood. What would one or two words would be?
Wow, that's quite a very massive one. Well, for the policymaker, I would say, why don't you just know about the other person's experience? Okay, and what would be the best thing you could do to make the other person feel heard? And it's that curiosity that comes with CBT as well. Like, what's this person going through? Okay, and how can I know about what they are going through? What could help me to know about their experience? And I think if you start asking this kind of question, I think it's just, you would think that is what we need to do, that sense of empathy, kindness, and to put yourself in someone else's position. And that's what most people don't realize. Some people probably would be in this environment, for all their life. They possibly haven't traveled to another context to live there for like maybe 3 years and see, what it feels like, the uncertainty that comes with it. And so we can have that, that understanding. So I guess we ask kind of question, it gives us that ability to imaginatively see how you could understand the other person's context, so that would be my word for policymakers. Maybe for therapists or trainees who are in training and they are person of color, I would say to them, yes, the road is tough, but you have a lot of inherent qualities to contribute, to do your work in a way that show up in that arena, take the punches, and keep your head up. And that would be my advice, because it's really challenging. You can remember last year I was doing a honorary contract. I wasn't paid, and I was still turn up, do the same hours as expected for me to do. That was within when we were having those protests going on in this UK and all of those things that was happening, the backlashes of all of those things. I was still seeing patients. And none of them were black patients; they were white patients. So it's tough. It's tough and dark. Some days you just feel like, should I do that or not? But you just have to show up in that arena, and roll up your sleeve and do the work, because you got in here to help people. And so that would be my advice for people, therapists of color, and always remember, stand your ground. Don't prove anything. Stand your ground. When you experience that dynamic that is not healthy, stand your ground, call it out, and confront it, rather than trying to internalize, trying to blame yourself, trying to be patient, trying to distract, avoid. Call it out, okay, and stand your ground, because it's tough. It's tough when you start to put the burden on yourself, and then things just start getting messy. You just get lost in your thoughts and all of those things. So, and the pain of racial discrimination is hard. It takes to show that it takes about 1 month plus for you to get rid of the mental health consequence of racial discrimination, of one act of racial discrimination, because it's going to linger. You question different things. So it's different. Okay. So stand your ground, show up, but call it out. Yeah. And then for clients who are considering, any of our services, I think I'm really genuine about helping people to navigate or get into this career path. If you're thinking of one, or to navigate any change you're navigating. And I think I'm a stone away. You really want to reach out, watch more of this channel. I hope I come back again, or just stay hooked to whatever platform you see me at.
Yeah, we'd love to have you back, wouldn't we?
And for our viewers as well, we will put Dr. Anthony's profile, socials, and website on the description box for you, so you can access it as well if you wanted to contact him directly for any one-to-one coaching as well. So you can always find it in the description box. And so thank you, Anthony.
Thank you so much. It's been really helpful and really insightful.
I'm quite pleased to be here.
And moving as well.
Yes, absolutely. It's a pleasure having you, Anthony. And one last thing for our viewers, to help us as well with making sure that you've been listened to and understood, you can use the comment section to write to us about any issues that you wanted us to explore in the next episodes, any topics that you wanted us to kind of, touch on, and we'll take it from there. So thank you, everyone.
Thank you, everyone.
Speaking to you in the next episode.
Thank you, Anthony. It's been great. Thank you so much.
It was so good to be here. Thank you. All right, bye now.